And all right. So I'll give it a second. I know sometimes it takes a second to get to everybody. All right. So just a reminder, this is for those associated with schools and the health department staff. So if you are with the lay public, we just ask you to drop off the call to save time for those individuals, but this is recorded and the recording and the slides will be posted on our public coronavirus school web pages. And for those of you on for your school, just make sure all the needed information gets passed on down to your school COVID liaisons and anyone else who might need it. First thing today, yesterday, there was guidance released from MMDHD, so essentially the state health department. And a press release was also put out that the state finally did release their guidance for a modified quarantine. The document, the first page looks like it does on the left there. The link is on the bottom, and then an infographic that they have is attached. Essentially, the main change that they have offered is that for those that are considered a close contact and the close contact and the person with COVID were both properly masked, if they're students and in the classroom at the time of exposure, they can return after 7 days if they have a negative rapid antigen test at 7 days, or they can continue coming to school if they have a negative rapid antigen test prior to coming to school for the 7 days after their last exposure on school days. So for most kids, they'll only have to be tested 5 or less days because of the weekends. So it gives one extra option to help keep kids in school, but again, it does require a fully masked situation. It doesn't apply to staff, and it just applies to the classroom setting. We had put together some guidance as well, anticipating this, and incorporated a little bit of the state's recommendations and also did discuss it with the state, but knowing the realities of our area a bit more, we did send out guidance to our 19 counties, to our school mailing list yesterday. So someone in your school should have gotten it yesterday. If not, it is posted on our websites. It's all of them are identical. So if you go to our school websites, you should find it. But again, the first page looks like this. There's a little bit of background about why the change in guidance and some background evidence supporting it. There are some infographics along with it that look much more busy, but basically it'll cover staff and students, masked and unmasked, and also vaccinated and previously ill, which the state does cover that as well. But basically, many states are doing this, but if both people were properly masked at the time of exposure, they can actually continue coming to school without any quarantine. They just need to be monitored. They need to be notified that they were a close contact and just be properly monitored. The safest is to do the daily testing for 7 days, as was discussed with the MDHHS guidance. We're also showing that you can do that with your educational staff as well. The difference here is just the distance. With properly masked kids, they're considered a close contact under 3 feet. With adults, it's under 6 feet. So again, the safest would be to have them do rapid antigen testing prior to coming to school each day for the 7 days following their last exposure. And an alternative is to simply just watch for symptoms and of course continue masking. If you have situations where someone is not properly masked, whether it's one or the other or both, if they are over 6 feet apart, we're not less than 6 feet apart. Then no quarantine is needed. I'm just noticing that this image right here should have a check mark by it. I went through this so many times, but I missed that one. So these all basically are all situations where they really don't meet the definition of a close contact. So these individuals just don't need to quarantine or do anything special. But if they are involving a person who's not properly masked and they are meeting the definition of a close contact, so less than 6 feet for more than 15 minutes in a 24-hour period, the safest thing to do is to continue with traditional quarantine. But an alternative would be to have them mask for 14 days after the exposure while they continue to come to school and require a negative rapid antigen test prior to coming to school for the 7 days after their last exposure. The text here on the side is a copy and paste from the guidance. This looks really busy, but it basically is just giving you a walkthrough of every possible scenario, but basically just saying if someone is a close contact but is fully vaccinated or was diagnosed with COVID in the last 3 months, you still need to notify them that they were a close contact so they can watch for symptoms. They should still wear a mask and should still get tested 3 to 5 days later, but they don't have to quarantine. So that just sorts that out. The big thing though, that covers, we're allowing it to cover really all in-school situations. And I'll talk about that in just a second, but
Dr. Moore,
the exposure happened, yeah.
I'm seeing people in the chat that can't see their screen, so I don't know if I can see it, but some others can't. I don't know if that's maybe you go out and come back in or with your share.
I can try. Yeah, I can try. I'm not doing it any different than usual, but I will unshare and then share again.
Thank you. It's worth a shot.
Yeah. All right, I'll wait just a second because I know sometimes it takes a second.
See it, but again, we'll see. Thank you.
Yeah. So yeah, I don't know why there's always.
I can see it now.
I can't see it, and I just don't. Yeah, I just don't know why that happens. I'm so sorry. And I'm sorry I can't see the comments when I have my PowerPoint up. I'm not the most tech savvy person in the world. So anyway, if someone is exposed in their household or in a non-school function, really the evidence shows that those are much, much higher risk for transmission. So we just can't support a modified quarantine in those situations. So if someone has a household contact with COVID or they were exposed at an outside function like a wedding or a party or Boy Scouts or some other event like that, they do need to stay in quarantine. There's no test out option or anything like that. That's just, those are really the highest risk situations in terms of exposure. So properly fitting mask, we do define in there. And that unfortunately really falls upon you and your staff to know, are these, is this kiddo one that wears it properly, or is this one that, wears it around their chin or that kind of thing. The other thing to consider, we do have it in the guidance, but certain situations like lunch, extracurriculars, band, athletics, gym, those kinds of things, those are situations where it's really hard to wear a mask properly and consistently. So those are situations where those properly masked scenarios may just not qualify. So this guidance we intend to apply to any school setting or activity. That includes athletics, that includes other things. But again, we just ask that you keep in mind that your older students, those over 12 and adults, do seem to be more likely to spread COVID and get more serious illness. So if you're erring on the side of caution of things, you know, that age group would be one to do that with. Students, for the most part, and kids are not really at super high risk for serious illness, but even though they may have asymptomatic infection, it is proven that they do take it home to their family members. And so, you know, that's why it's really important to still identify close contacts, still notify the family, because they may need to make decisions about who their kids are around based on the risks to family members. And then I included the list of kind of the high risk, intermediate risk, and low risk activities and sports, just to sort of help with decision making as well. You know, if you're deciding between should they quarantine or should they test to stay is a term that's used a lot. This might help put those into different categories. For the sports, that's based on the NCAA criteria. So I know this is a lot. Really, your choice to follow any alternative or modified quarantine is your option. The safest thing is still a 14-day quarantine, but also we do know that transmission in schools with appropriate masking is very low. And as an alternative, testing is possibly an option. So we'll just have to wait and see how this works. This is from the state guidance, and I did put it in our guidance as well, but there are many options to get antigen testing support from the state. They are offering some home antigen test kits that you can provide to families, because the options are that families can test at home prior to sending kiddos to school, or you can test them at school prior to them going to class. So those are options. I did include here the document on the left is a document that went to healthcare providers that talks about home antigen testing and how to handle results. It's really a nice document and easy read. So if you just want to know more about home antigen test results and how to deal with them, it's a nice document. I included the algorithm from the CDC for interpreting antigen results. And then just as a reminder, about a week before most schools start, a week or two before most schools start, we sent out a document called Management of COVID-19 Cases. And I think it was page 9, had this algorithm that I put together. It does have a step in there to put into quarantine and finish quarantine. I put a little mark over those right now. We have a lot of documents to update now with this new guidance. But this is just another algorithm to help you work through antigen test results. Another update that we just learned about today, because it's not really easily found, but apparently earlier this month there was an update in the definitions for school outbreaks and clusters. So I just shared a link here for you guys, and then the basics are here. Previously, there was a lot of specifics about it had to be PCR tests and it had to be lab confirmed, and a lot of other things. And now they've really simplified it to be more like the real world, and a school case is really any confirmed or probable case. So confirmed cases are those that have tested positive with PCR. Probable cases are those that are sick and have been exposed to someone who's positive, and still technically they consider antigen tests done by a healthcare provider or actually by you guys in the school, because you have a CLIA certificate, are still labeled as probable, which we're all really frustrated by that. But anyway, so they have just made some changes, again, making it a little more compatible with the real world. but I just wanted you to be aware of the definitions that we do use. So as a reminder, we're not keeping that whole big table of data anymore just because it gets out of date so quickly, and I think everyone has a pretty good understanding of how to find your data through mystartmap.info. If there's anyone on the call who's not sure how to do that, I did walk through it last week on the call if you want to watch that video, or I'm happy to stay on a little bit after the call and we can walk through it. Just holler when I open it up for questions at the end. One thing I did pull that you guys really can't find anywhere else, I went back through July until today and pulled all of our confirmed and probable cases between ages 5 and 18 that we've had reported. So in all 19 counties that I cover, this has been our case counts for those age groups. Note that this last data point is just for the last 2 days. I wanted to include that because I was doing every 2 weeks, but I noticed that just in the last 2 days, we've had a really substantial number of cases get reported for that age group. So we're not seeing a decrease. We're just seeing, again, about half as many. So in the last 2 weeks, from the 24th to the 6th, we had 250 cases in that age group. In the last 2 days, we've had 120. So about half as many in just 2 days as we had in the last 2 weeks. Now for each district, this is kind of busy, but you'll get a copy of these slides so you can kind of pick through it. This is for the 6 counties in Central Michigan District Health Department. And again, this last data point is only for the last 2 days, whereas each previous data point is for a 2-week time period. So you can see pretty much everyone has been going up just at different rates. And this last 2 days, has been a pretty significant increase compared to the last 2 weeks. These are the 3 counties of Mid-Michigan District Health Department. Same thing. And this final one has 10 counties in it, so it looks like a pile of dry spaghetti. But again, pretty much the trend. I hate to pick on Kalkaska, but they've had more in the last 2 days than they've had in the last 2 weeks. So did, what is this one here? Lake County. So just some things, and I'll try to continue doing this every time we meet, so we can kind of keep an eye on this. I don't know, some of these are homeschooled, some might be 18-year-old college students, but just to give an idea of that demographic in our areas. Like I've done in previous weeks, this is just some copy and pastes from a really good data and modeling report that the state puts out. This is from Tuesday. So Michigan as a whole continues to be at high transmission. Our percent positivity has continued to increase, although it's only gone up 0.1%. Our case rates are continuing to increase. We're still on the low end compared to other states in the country when it comes to case rates. We're still seeing almost solely the Delta variant. I know people might ask about the Mu variant later. They did state that there have been so far only 10 of those reported in Michigan. And in other states, it seems like the Delta variant seems to continue to dominate. So hopefully we won't see that variant taking over. We continue to see increases in our hospitalization, but again, only 0.1%. We are low in the brackets for hospital bed utilization in the country, which is good, but our deaths continue to increase. So hopefully that slows. So this has been our transmission level, so our weekly cases per 100,000. Again, hopefully we're starting to level off. It's hard to know what will come with time. These are the age groups. As you'll notice, the 10 to 19-year-old and the 0 to 9-year-old had a pretty significant jump this last week. The 20 to 29-year-old had are on the steeper end. This gives the actual percent increases. So age group of 0 to 9 had the biggest single increase 1-week increase so far during the pandemic. So they went up 28% in the last week. 3.1% of all emergency room visits are for COVID-like illness. Again, maybe we're starting to plateau, cross our fingers. Hospitalizations, again, maybe are starting to level off, but still high. This is a comparison of Michigan, which is this blue line here at the bottom, to other states that have already really had their big Delta surge. They spiked about a month or so before we did and are now starting to come down. Again, we started a bit later, and whether or not we're still going to go up higher or we're starting to go down, it's kind of soon to tell, but just a comparison. So pediatric cases in the US, over the whole pandemic, kids have been about 15% of all cases. In the week from August 26th to the 2nd, they were 26.8%, so over a quarter of all cases, which was an increase from the previous week. In the past 2 weeks, there was a 10% increase compared to the prior 2 weeks. A little bit more kids than previous were getting tested, about the same amount were testing positive, and the hospitalization rates were similar. Our state saw an additional, 30 additional outbreaks were reported in schools last week, which schools are in session, so that would make more sense. They do give a breakdown here. There were 7 additional in high schools, 6 additional in middle schools, 16 in K elementary, and 1 additional in an administration. So, and you can see the total number of cases associated with all those different outbreaks are listed here as well. So that is what I have for my presentation. I will stop sharing my screen here. And I will pull up questions. If you have any questions, you can throw them in the chat box. And at the end, I'll open up for phone calls to people who might not have access to the chat box. So if we have a rapid antigen test left from last year's athletic testing, can it still be used, or have they expired? They should have an expiration date on them or on the box. And if not, if you have like a lot number or something, you can email it to us and we can check on that. I haven't looked at them enough to know where the expiration date is printed on those. But we do know that there are a lot of different lots that are expiring this month and next month. Is there any anticipation of updated quarantine guidance for staff coming anytime soon? So I don't expect MDHHS will put out any new guidance, but again, the guidance that we just discussed, we are applying it to staff. And so Melissa replied to Stacy about the antigen test. So is there an infographic we should be seeing? Okay, I think this is about my slides not showing up. More about my slides not showing up, I'm sorry. What about people who got COVID more than 3 months ago? Still at this time, they're saying 3 months, which is very frustrating. I don't know why that's not longer at this point, but it is still just 90 days for that. Could everybody just make sure your mics are muted? That'd be great. It looks like the same graphic. Okay, I see it now. It's working now. So, okay. Are there rapid antigen tests that individuals can take home to administer? So yes, there are home antigen tests. And again, you can go through the ISD, can go through the state and see about availability of getting home antigen tests that you can send home with families. You can also purchase them. They can purchase them through most pharmacies and places like Meijer or Target. Obviously, cost is an issue for a lot of our families, so that gets to be a little tricky. But there are only certain ones that are FDA approved for home use. So you really aren't supposed to send home any of the ones you have for school use for home use because they're not approved for that. Some of them are the exact same tests. They just have different instructions with them, again, making them user-friendly for home use. How do you suggest schools verify that the rapid antigen tests were done at home that morning and every morning for 7 days? So that's been a big question of debate, and it honestly is up to what you're comfortable with. If you want to just take their word for it, or if you want to require a picture, if assuming that they have some kind of a smartphone that can do that. But the pros and cons of doing home testing is, one, if they end up being positive, they don't come into your school at all, so you don't have any further contacts or potential for spread. You don't have to wait for a parent to come back and pick them up, things like that, but you always have that concern of, are they lying? But we know right now that we have kids coming to school with symptoms and other things, and we know that things aren't perfect right now either. So it's really up to you what you feel comfortable with, but I think for the majority, we're just taking their word for it. So I was trying to attach the testing extension document, but it is not working. If anyone needs it, okay. So yeah, and in the document we emailed out yesterday, there are links, live links to all the testing resources as well. So here's the memo from Abbott regarding the extension product expiration. So Melissa had put a link in the chat with the expiration dates for your antigen test kits, because some of them were extended. So you can check that. There was another company besides Binax now that the state was using. So if you have that company, you may need to check with the state and see if that was extended or not. Is there information about how many of the children who are positive have been hospitalized or at home with severe illness? Actually, I did look up how many kids we have had that have been reported to us to be hospitalized, and there were only maybe 10 to 12, and the last one was in May. So that's in the 19 counties that I cover. Your reporting is not always perfect, but that's the information that I was able to find yesterday. In terms of severe illness, I'd have to dig further. It's really hard to pull that kind of information because there's not a checkbox so much for that one. I do know another case of the MDIS that was reported in the state in August. And that usually is a month, 1 to 3 months behind a surge because it's a later onset. So under the new definition of 10% of the students you just showed, or the old definition, so that's related to the outbreak definition, I believe. And I know I didn't really leave it there long enough to read it completely, but it had for an outbreak. So multiple cases comprising at least 10% of students, teachers, or staff within a specific core group, or at least 3 cases within a specified core group. And a core group includes, but is not limited to, extracurricular activities, cohort groups, classrooms, before or after school care, etc. So it's either 3 or more cases that are somehow linked within the school, or you just in general have 10% or more. So it's, again, they made some changes, but kind of has the same feel to it overall. Did quarantine switch from 10 to 14 days? So the standard safest is always and has always been 14 days. That is still what the CDC recommends, but there are options to use 10 days in certain situations if you feel comfortable with that person monitoring for symptoms for the remaining 4 days. There's about a 1 in 20 or less chance that in those 4 following days, someone might go on to become contagious. So there is some risk, but it's a low risk. So long story short, it is still 14 days, but there's an option to shorten it to 10 days with 4 days of monitoring for symptoms afterwards. And that's what we use most of the time, especially with our students, just because we want to keep them in school as much as possible. What do we do with students or staff who have had a confirmed positive COVID case, but it was more than 3 months old? The paperwork only mentions 3 months. It is 3 months. I mean, at this point, it's, if you've had a case, if you've been exposed and been previously diagnosed within the last 90 days, you do not have to quarantine. If it's longer than 90 days ago, they are supposed to quarantine, or they can follow, you basically treat them like a brand new exposure that's never had COVID before. So you could follow one of those other modified quarantine options. So again, the hospitalized children would be very good data to have. So again, for our 19 counties, I did pull that just to see if I was seeing anything significant, and we haven't had any reported. So I'll keep checking that and trying to report that and reporting that each week to you guys. A parent has asked, if my child has tests that shows they have antibodies present, do they still need to quarantine? If they've not been infected within 3 months and they've not been fully vaccinated, yes, they do. We still don't know what level of antibodies is protective against infection and protective against contagious infection. And there is cross-reactivity with other coronaviruses. So yes, the antibody testing is not used in that way at all. I was just told by our school nurse we have very hard time to find now, that they are very hard to find now as people are starting to buy them in quantity for daily testing. So I'm assuming that's talking about the home tests. Yeah, and we had heard that too in some areas. I know I've seen them like on Walmart.com. I don't know if I haven't checked that recently though. I don't know if that's a possibility. But again, the state was supposed to be procuring quite a few of them, so hopefully they can supply schools who plan to use them appropriately to get some. For symptomatic students that are sent home from school, is the recommendation still a CLIA certified PCR test from a lab? It can be a rapid antigen test. If it is negative, they need to have a PCR test to confirm. Because if you have a symptomatic person with a negative antigen test, there is a risk it could be a false negative. If it gets a little hazy in there, if they have symptoms that are really not like COVID and the antigen test is negative and the incidence of COVID in the area is really low, you may be able to accept the antigen test, but you're not clinicians, you don't have to worry about that. So I know it's complicated. When students who are informed of quarantine status per health department guidance arrives at school and we report back to the health department, what is the follow-up for the families from the health department? When a student arrives to school, so does that mean if they're supposed to stay home but they come to school anyways? I'm not clear on that question. So I don't know if Adele is on the call and wants to clarify.
In the chat, yes.
So I guess I'd have to ask my CD nurses, but typically I would expect that we would follow up with the family and educate them further on their need to comply with quarantine. I don't know if anyone who has boots on the ground wants to answer that. So if we have a student who's supposed to be in quarantine, but they show up to school anyway, and the school calls us and tells us, do I have any CD nurses on the line?
Doc, this is Becky. I think this is one of my schools. The student was still entered as a contact into the list and sent to Trace Force and contacted by Trace Force. Unfortunately, I've heard a couple of, and I've talked with a couple of my schools that staff has been telling parents that quarantine's optional. So when they get told that, it's very difficult to get them to comply with quarantine. So yeah, we've had one situation so far. Out of the 10 that were quarantined for this case, only one did continue to go to school. So I thought that was a pretty good odds on that one, at least.
It is pretty good odds. Becky, my question though, like for a family that does that, and obviously if it's a messaging from staff, we can address that directly, but for a student who arrives and then the question we get often is, well, what happens if my kid comes? And I said, well, we're required to contact the health department. And they said, what'll they do? I'm like, I have no idea. Through the health department. They'll do what they do.
We really don't have any recourse in that situation.
Okay, thank you.
So the way I look at it is, if it's really like a doctor saying this kid has strep and can't come back until they've been on antibiotics for a day, and if they came back early, what would happen? And in our view, and I know everyone has a different thought on this, but that's, the school has then the authority to say you're not supposed to be here. For us to make them not be here, we would have to give them a written order of quarantine and then get a court order and then legally, like, get law enforcement to confine them. And by the time all that happens, it's typically well past the 10-day quarantine period. So we pretty much have to just rely on businesses, offices, schools, places like that to say, no, you should be on quarantine, you can't come here. And we know that that's not always going to work, but, and then, traditionally we could just trust people and they would comply with what we asked them to do, but it's gotten kind of away from us. Our ISD has center-based classes and students that are immunocompromised with an inability to express symptoms and illnesses and have a hard time keeping masks on due to disabilities. Would you recommend the 14-day quarantine for them if close contact versus the 10-day modified option? Really, again, there's not perfect answers. Sometimes in those situations, for them to be out of school is a harm to them just because they need the supports of the school and their therapists. You could incorporate testing. I mean, you could have them come back at 10 days with a test. You could do different things, but if the families are able to keep them home 14 days, if it's not causing medical, physical, educational, nutritional, different hardships to the student, the safest quarantine is 14 days. So again, with looking at the modified quarantine plan, that's taking into consideration the harms of keeping kids out of school. So it's kind of a harm risk or a risk benefit analysis. And again, if you have students where keeping them out 14 days is not going to be a major hardship, that is definitely the safest thing to do. All right, well, I have hit the end of the questions in the chat. If anyone's on the call or unable to use chat, oh, there's another one. Do we know a timeline of when the guidance on the website will be updated to match the new info released yesterday? So I'm not sure which guidance you mean. The document that I reviewed today, that is on our website. I know we do have documents out there that say your children must quarantine for 10 days or, different things. It's going to be challenging to update everything because we don't know what every school is going to follow. So if there's specific things you need us to update, you could email me links or put links in the message box or something. But I do know that a lot of our guidance documents are now outdated because of these updates.
This is Adele again. The question is on the website, the last update was May, which was forever ago. And we know that stuff changes on the daily sometimes. Obviously, you guys are living that too. But I think the language that the parents are coming up with, the recommended, is from that link I sent you, where it says it is recommended that you self-quarantine, and they come back with, but the website says recommended. But all of the new stuff that we saw yesterday, it said need to and must, and I think that would probably make a difference as far as the messaging and consistency too. So I was just wondering if we knew, I mean, it's going to take time, we know that, but if we had a timeline estimate.
Okay. So Leslie is our information officer, and she just commented that she will get that updated. Yeah, I try to stick with advise, and it is the words are very important anymore how you phrase it. Yeah, so she'll get on that. So if anyone has any questions, go ahead and unmute or type your questions in. And again, if there is a supporting document we have out there that you need updated because of any of these changes, send me a link, because it's kind of hard to, there's a lot of things and it's hard to prioritize all of it. Is there anyone who needed a walkthrough on how to use My Start Map? All right, last call for questions. All right, guys. Well, let me know if you come up with any questions or concerns going through things, and we'll talk again next Thursday. Have a great rest of your week.